Hi, our topic this week is focused on patients' engagement and health behavior change. Patients' engagement is considered important to healthcare system and has positive impacts on health outcome. The reason why it is considered important is based on two facts. The first one is that the lack of it can result in preventable deaths, including smoking, obesity, poor blood sugar control, etc. The second fact is that the traditional way of care delivery and face-to-face interaction can only cover limited patients. As a result, a new form, the information technology, in other words, IT platforms, with patients' engagement and peer-to-peer support in social media are introduced. As for the evaluation of its effectiveness, there are numbers of positive results based on one research, 51%, but the conclusion is still unclear. I think this kind of uncertainty can connect to the discussion part. To figure out how to engage patients and change their behavior meaningfully, we need a systematic understanding.
So the article states that engagements with healthcare professionals were very limiting and that the effects of patient engagement can be emulated through self management with various apps such as social media or text messages. With things like patient portals and remote patient monitoring, it is possible for patients to stay updated on their conditions without the need to physically visit their healthcare providers to ask questions. With easier accessibility, patients are more likely to ask questions and gain information through forums at their own convenience rather than waiting for the chance to talk to a healthcare professional. The methods used in this article was the analysis of four databases: PubMed, Web of Science, PsycInfo, and Google Scholar to find research articles on the effects of information technology on health. All abstracts and articles were reviewed by two investigators and they classified their findings into positive effects of information technology or negative and no effects in improvement with information technology.
Hi, so I'm going to be talking about the results. Like my group member said, information technology has a big impact in our daily lives, especially in our health outcomes. This particular paper scanned over 170 articles and reviewed them in order to show how technology can impact five major things: how informational technology platforms affects our health outcomes, patient engagement in health behavior change, theory of health behavior, ways to assess health outcomes, and usability assessment. So overall, there was 89% of studies which showed positive impact on patient behavior, and 93% reported high levels of improvement in patient engagement. So these are all outstanding numbers, which proves the idea that technology can be something that is more useful than just our traditional healthcare. There's also some of the examples which I found interesting in the article that they found about text messaging and social media. 81% of the studies reported that social media was helpful in improving patient engagement. So one study found that Facebook provided a forum for people reporting their personal experiences, asking questions, and receiving direct feedback for people living with diabetes. Another study showed that Twitter usage among cancer patients was a valuable medium for sharing information, discussing treatments. What's also cool was mobile-based interventions also showed 75% of usable interventions that had a positive impact on health outcomes. So one study showed that instant messaging was found to be helpful in patients to remember when to take their medications and be engaged in treatment planning. So overall, what this article proved was that there was a positive health behavior change through patient engagement with most technological platforms.
Overall, according to the study and reviews, patients have positive outcomes from IT platform-based interventions. With these technologies, patients can easily track their progress and health data with the click of a button. Although the data collected have been helpful in getting patients to continue with their progress, there are also many drawbacks that need to be noted. First, the data collected cannot be standardized and made into a cohesive report for healthcare providers. An article from Harvard Business Review warned the importance of having a reliable and holistic data from the patient for healthcare providers to diagnose and review the patient's data. Secondly, many of the older population are not as familiar with these technologies and thus less likely to use it to track their health. This problem has been brought up at the Wellness Promotion Program at UCI before, and it is a common problem for everyone. To combat these problems, healthcare sectors would have to come up with a standard for IT platform-based health interventions.
So recently, UCI researchers have developed a wearable monitor that basically tracks the rate and volume of a wearer's respiration. And this is done by placing a thin plastic sheet over the person's ribs and abdomen. And this basically what it does, it measures like the local strain on the person. And the thing about this technology is that it could help detect an ongoing attack. For example, if someone has asthma, then the device can be used to um, maybe like identify a potential like attack that can occur. And what really stood out to me was that this technology was originally based on a children's toy called Shrink Dinks. Basically, this is like a sheet of plastic that people, kids can like draw on, and then basically they heat it up and it shrinks. Um, so I thought that the concept was really creative because it sort of took like an existing idea and sort of incorporated it within the medical setting. And this also got me thinking of other possibilities, maybe other children toys that could be sort of incorporated in the same way.